It's time to get the story behind the story. Interviews with newsmakers, news breakers, and Vermonters making a difference. WCAX presents 802 News with Mark Johnson. Here's Mark.
It's been almost exactly 4 years since the first reported case of COVID-19 here in Vermont. People today are still contracting the virus, but its severity and its impact, the number of cases and deaths, and the fear and disruption it caused has diminished significantly since those tense times in 2020 and during subsequent spikes. In this edition of 802 News, sponsored in part by Red Hen Baking Company, we talk with Dan Daltry about that frightening first year of the pandemic and his work as a contact tracer for the Vermont Department of Health. In that job, he interviewed people who had tested positive and called those they'd been in close contact with in an effort to slow the spread as the virus ripped through the state like a wildfire. The work, as you will hear, was intense and took its toll, both emotionally and physically. We were fortunate to have people like Dan Daltry and many others at the Department of Health whose tireless efforts undoubtedly resulted in fewer cases, fewer hospitalizations, fewer deaths, and less heartbreak. The latest figures from the Vermont Department of Health show more than 1,130 people in Vermont have died as a result of the virus and more than 1.1 million nationwide.
In March 2020, I was here in Vermont, bracing for the storm. We knew in this very room that we are in, my office is right next door. There had been for 30 days, 60 days, 90 days prior, teams of epidemiologists meeting in here, preparing, knowing that COVID would come, that it would come to the United States, that it would hit at some point. We were studying abroad, but knew that it was a matter of time, just because of the models and the information being shared, that it would come to the United States, and eventually it would come to Vermont as well. So they were doing exercises, they were planning. I wasn't in on those conversations in the beginning. It was the direct epi folks that would play a role. I was right next door. The beginning of March, I want to say our first case might have been on March 9th. But when that came, everything changed. Yes, we were prepared. Yes, we were knowing that this day would come. Something really changed or accelerated once we had our first case. There was a bit of a knowledge that this wasn't going to be one and done, that we needed to respond, we needed to support the individual in their respective. There was some sort of sense that this is the beginning of something new. And that first case we certainly connected with, but the conversations, the talking, the planning that started happening really quick went to another level right after we identified the first individual here in Vermont living with the virus, trying to think about what we are going to do next. And so there was no longer, immediately after the first case, there was no such thing as a work day. Gone. Everything was out the window. We knew right away something was different, and a number of folks just went all in at the beginning. I think staff left here that first night at 10 o'clock. And again, we've seen other things come. We've seen, since that time, Mpox has arrived here in Vermont. We didn't stay to those hours. We've seen new and novel infections, but there was something different about COVID that we knew, even without stating out loud, we're all in. We're all in. And it changed. It changed everything. It was a paradigm shift in our public health response because of a pandemic was happening right in front of us. Even before it was named, we knew that we were dealing with a pandemic.
How did you know it wasn't going to be another SARS or monkeypox or one of the ones that seemed to come and blow out?
Yeah, there was something about this. Other public health professionals could probably give you better language around this. To me, this thing had roots. It just, while we watched the rate of growth in spread that was happening abroad, it no way looked like something that was going to be one and done. It was something that was digging in, entrenching, and spreading, and people were dying. This was a science fiction movie that had become a reality. And so I think that's kind of what set it apart maybe from other infections, is we saw the rate of growth, the amount or canvas of spread, and there was no signs that it was retreating, only growing. And so it was concerning as we saw the first case hit in New York or on the West Coast. When it landed, it spread and continued to grow.
How did your life change?
Yeah, so my job and my life became very blurry because my life became my job. There was no, I didn't realize it until 3 weeks in, but the job wasn't stopping when I left this office. There wasn't going home and putting down my bag, unlocking the door, and relaxing. Because my wife, my children, we were all prey to this. My mother, who was a new widow at the time, just living here in Vermont, in an assisted living, suddenly she was no longer going to get the tour of Vermont in the welcome wagon. She was in senior living and she was high risk. So there was no longer a personal life, because my professional life was my personal life. There is a bit of respite that you get when you can walk away from the work at the end of the day, whenever that day comes, whenever the whistle blows and you decide or work decides that it's done, it's done. With COVID, there was no whistle blowing, and I couldn't escape it. My news feeds, the looking at the news, the listening to the radio, COVID, 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 COVID. And meanwhile, this is the thing that I'm working on at work. No longer was I working individuals impacted with chlamydia that have sexual health needs, It was all focused on COVID. And what can we do? I think in the beginning days, we were still under that illusion that we could wrap this up. We could tie it in a bow. If we could just help those individuals that were diagnosed and those around them, if we could hold tight to them and find out how wide it is and just help them to monitor and to stay together, things were going to be okay. I was in a room with other disease investigation specialists, people that are trained to know how to talk to people diagnosed and gain information, to interview people like we're doing here, to gain information, to hear the story, and then begin to think about how we need to pivot, how we need to take action. We were in a room. We had 13 cases before us with unique identifiers, but we're looking to see kind of trends. And if, between these 13 different cases and information we had, if we could just connect the dots, if it would just come together. But the problem is it was going out. It was going out. And that was one of the earliest signs that this thing is not going to be wrapped. After 3 weeks, we knew that regardless of working from 6 a.m. to 11:30 at night, we weren't going to stop this thing. It was beyond us.
What did you do on a day-to-day basis? So you get in here in the morning. What was a day like?
Every day was changing, especially in the beginning days. We didn't know enough. Nobody knew enough about this virus, how it was transmitted, how it was spread, what are the tests that we can use. If there are tests available, they were reserved for certain higher risk populations. We had to braid the resources we had because they weren't in abundance to priority folks. Part of my day, there was no do this, then that. It was definitely a non-linear day, doing the best that you could from the moment that you showed up. My core area or concentration was on case interviewing and interviewing folks that had been diagnosed, but also wearing the hat of trying to support a team of individuals that were new to interviewing. They had strong people skills, but maybe never had done an interview like this, where they don't know the person on the other line. They don't see the person on the other line. How do you build trust within 1 minute of a hello? So shifting from knowing and doing an interview, but also around a virus that we are still trying to understand, so there's a complexity there, to also being able to shift and to step out when I can to help some of my peers that are learning and growing. And in listening to my peers, also learning and teaching myself, because I didn't have all the answers. We didn't have all the answers. Together we were getting better, We were looking for information from the CDC, and that was critical. But also learning from the consumers we served. Where were you? What were you doing? Helped to build a clearer picture of how this thing could be transmitted. One of my mentors in this field, Barry, had done STI interviewing, sexually transmitted infection interviewing, since the early 80s. And he had retired by the time COVID had come. I had the joy of working with him for 3 years. But Barry would talk to me about the early days of HIV and how it was new, it was novel, it was different than STIs. And there was something about that. There was something kind of exciting because it was new and different. And so you absolutely, it commands attention, and you feel like you're growing in a way by doing something new beyond what it is you already do. But he also talked about how kind of frightening it was because nobody knew how HIV was being transmitted in the early days. Right. And death almost seemed around the corner. Now, we've learned more about what was happening then. There was a part of me that always was in awe that Barry had that experience. He was there. He was the one that delivered the first HIV result in Vermont from an HIV test. He delivered it to the Wow. That's a heavy sort of thing. Unfortunately, with COVID, I had my Barry experience in the sense that this thing was new. There were a lot of unknowns, and we had to learn because literally lives were on the line. There's telling somebody that was 85 years old that they had to wait outside the room of their loved one that they had been married to over 50 years, that they couldn't hold their hand because their health would be at risk. I just didn't know enough then to be able to tell that person they could be there with their partner. I had to think about them. I'm hoping for the best for your partner and that they will recover. But I also need to think about you. And you could be exposing yourself as well. These were hard things. We didn't know the science in those early days, and lives were being lost. On a lighter note, I contacted somebody. They were on vacation with friends in another state, southern. What do we do in, November through April? Some folks go down south. They find some sun opposed to our Vermont terrific weather, right? And I reached somebody. We had to go with urgency with these calls. And so I'm calling somebody at 10 o'clock and I'm telling them no more sun in the fun for you. Is there a way that you could stay in? And he laughs and he jokes and he says, yeah, you all hit the beach. I'm staying in with the drinks. And it was, we joked. But as I hung up that phone, I was wondering when the joke would fade, maybe potentially for this person, because we didn't know what was ahead and there wasn't a test that I could refer them to get in that respective area. Testing wasn't widely available. It was a wait and see. There is nothing grittier or grislier than that wait and see approach that we had, but that's all that we had in the beginning days.
The word helpless comes to mind.
Yeah.
Did you feel helpless?
I felt limited. But maybe it's the social worker in me. I always held on to a sense of hope. That something was going to come, that we were going to find something out. And my colleagues, too, were looking around for hope. We had a feeling when we were interviewing people that we were going to find something. I mean, the number of colleagues that I worked with, we were all looking for that aha moment. Who can learn the most? Who can apply what they know? There was this strength and resiliency among the folks that I got to serve with that were pursuing that aha moment, that break. I think that's what held us up and held us strong, is that we knew that collectively, if we could partner with each other and we could partner with those being impacted and our leaders from Atlanta in the World Health Organization, something was going to come together. There was always going to be hope. And so as low as I got in the response, or sometimes feeling defeated, I still always had a sense of hope. So never did I feel completely helpless. Every day was a new opportunity, and it was something that I don't think anyone wanted to give up, that didn't want to stop serving. Holidays were gone. Weekends were gone. Leisure was pretty much gone. But my colleagues and I, we didn't know anything different than to serve. This was our public health moment. This is what we've been training for. We've been doing what we do with vigilance to help. But now was a time to take our skills and really use them for the moment that was calling us. It wasn't until after I was in the response for greater than a year, and I found out that I was going to be demobilized, that I was, that things had changed, that we could shift, that we could start beginning to do more fully our other jobs. And I told my wife, that I'm being demobilized. And it was hard, because I didn't want to let go of this thing. And what Melissa said to me in that moment is, I'm glad. I'm glad for you, and I'm glad for our family that you're going to get a chance to step down and step away from this. We were worried about you. We thought that we lost you there for a little bit. This is all I knew. This was all I knew. And it was my moment as a public health professional to serve. I lost time with family. I lost some critical moments. But I tried to focus on the many that were needed. And I am so grateful to my wife and to my kids that they had that resiliency in each other, and they were able to find a way while I was off doing my thing. But it was in that moment of beginning to demobilize that I realized how far in I had gotten and wasn't aware. And it was hard to transition out of something that you know so fully and intently. I'm driven by the work that I get to do for sexual health, and I find it an absolute privilege. It's all I've ever wanted to do. Little did I know that this pandemic would show me something else that I had in me that I hope was of value to those that I worked along with and worked for.
Was everybody else like that too?
In their own ways. I think that was the thing for me. You didn't want to let up because you saw how hard people around you were working. People that were way outside. This didn't happen with many, but there were some folks that I saw that were beyond themselves and needed some of that help that I needed when I came down. I could see it in others. I couldn't see it in myself. But you never wanted to step down because your colleagues seemed so strong and so driven that you couldn't help but to be inspired to be driven yourself, you know? Yeah.
Tell me about your wife. Tell me about your kids.
My wife is an art therapist. She has used the arts to help mainly with youth. She's a psychotherapist, but art therapy is a part of the medium that she uses in which to communicate with individuals that are trying to address and manage different feelings or impacts that has come along their way in life, right? She's a healer. She'll partner with you. She'll listen to you. She'll share wisdom as she has it, you know. Very caring and nurturing individual. My kids, love my kids. Outgoing, brilliant individuals. Different, too. My son, you couldn't find... I have been hard-pressed to find a greater energy. He's always on. He's always thinking. When my wife, Melissa, told me that we were going to have a second child, I was thinking, oh, I don't know if I have this in me, because my son's a lot of energy and thought and constantly going. Rose is a beautiful complement to Jonah. She has her own vigor and intelligence. Hers is a quieter presence. They really are a great balance, but incredible supports and cheerleaders. They show me how to see the world with some nice eyes.
Did you know you were gone too?
No, not at all. And I remember about 3 or 4 months in that, or even deeper than that, by the time it got to Thanksgiving, and Thanksgiving didn't mean a thing to me. I went home and I told Melissa, so don't know when I'm going to be able to get home for dinner. You know, I'm just kind of planning ahead, but don't know when I'm going to get there. I can, if the grocery store is open, depending upon what things are available, I'll try to patch something together that you all can cook. She said, whoa, wait a minute. Thanksgiving. You're talking about Thanksgiving. Well, yeah, I have this job to do, and Daniel, I'm not so sure I'm comfortable with you not being there for Thanksgiving. Well, I'll be there. I'll get there at some point. I promise. I ultimately didn't work on Thanksgiving. My colleagues did. And, you know, Melissa's idea, let's go for a hike. We went for a local hike. My phone was on me the whole time. I was checking email the whole time. And she says to me, you know, I asked for you to be off this day, and it was granted for you to be off this day. If you think about your colleagues that are working, you should honor everyone and be off this day because others aren't. Right now, the way that you've been acting the majority of this day, you just might as well be in the office because you're not really off right now. That was a beginning sign to me that something was off for me. I didn't get in advance why I should be off on Thanksgiving. And there I was off, but I was kind of on because checking the emails and the texts but it was a beginning of a moment that something might be off in me, that I might be a little bit too deep in this thing. But that was a fleeting moment because it all continued again. I got back into it full swing. It wouldn't be until May of that following year of 21 where I would start to get the news that I was going to be demobilized, where I started to connect the dots.
It's so interesting you use the word demobilize, because I think about that in the context almost of war. You know, an army being demobilized.
Sure.
That's different than I changed my job.
Yeah. I felt like there was a battle with this virus. And, you know, it was this virus versus humanity. And we had to find a way. We just had to find a way. I didn't believe these stories that we were, by our top health advisors, that we were going to have to live for this for 3 years. Didn't want to believe that if we just fought hard enough, that we could do something, you know? And that hope came especially when we got our first round of vaccine, you know? Life's going to go back again. You know, one of my mentors in this field, a CDC retiree, he was a public health advisor. Vaccines were there. They were great. His daughter's wedding was back on, and he invited me to his daughter's wedding. So there I was, flying down to Captain Tardius's daughter's wedding, you know? I'd missed his 60th birthday, but there is no way I was going to miss his daughter's wedding. That was an honor. And we went, and I even saw people with masks off. That was wild. Wasn't used or ready for that. I knew we were all vaccinated. We had hope, you know, in May of 2021. I had about 4 weeks of being out of this and having a sense of hope that, like, between testing, between knowing transmission and knowing, you know, there are different ways, cumulative exposure, 6 feet distance. We had science on our side. We had testing on our side. We had incredible investments in public health infrastructure that we were winning. But that damn virus, it kept adapting. And it was evolving at a clip that we had never seen. And in those early days, it was still evolving to deadly strains. Ultimately, what happened with COVID is we kept learning and adapting. You know, we moved from antigen testing to PCR testing. We moved from this initial vaccine against 4 strains to a vaccine against 9 strains. Like, we evolved really quickly. HIV used to be called the great teacher. In my lifetime, COVID now is the greatest teacher of all. We've learned so much from HIV. We've been able to fight cancers differently and better than ever thanks to what we learned with targeted treatment in HIV. COVID helped us to understand even further the needs for treatment, testing, and vaccine to move at a quick clip. You know, all those lessons were learned in HIV. And then with COVID, we had to learn them again and advance them again. You know, I'm grateful for the scientists that we have around us, from the political leaders that we have, the investments that have come into public health infrastructure to help serve people. As we look at various things that are happening around our world, as you know, the world heats up, as we see new infections, certainly we've got to have wider eyes to the needs that are we're going to have, and events or issues that are going to impact humanity. We responded quickly with COVID, and that was incredibly encouraging. And to me, again, hope and hopelessness, and I'm all of that and more. I think with COVID, as strange as this may sound, it also showed me great hope for what we can do as humanity to address the concerns that do emerge. It's not without a cost, but it also shows an incredible amount of strength, resilience, and hope for what we can do, how we can rise up together to address even the greatest of pandemics that we've experienced in our lifetime. You know, I'm not sure in earlier days of science if that would have been the case. Would we have been ready? You know, I think there's great hope for what we can address when we look back at COVID and saw what we did. It's not gone. It's still here. I still wear a mask frequently. But there is hope.
We'll continue our discussion with Dan Daltry, a contact tracer for the Vermont Department of Health, after a word from our sponsor. At Red Hen Baking Company, they believe pure, uncomplicated ingredients in the hands of skilled artisans are the building blocks for great food. They're dedicated to creating the best food from the best ingredients. You'll find an ever-changing lineup of delicious pastries, sandwiches, and soups at their beautiful cafe off Route 2 in Middlesex, just off I-89. Their breads are also available in many other locations. Led by owners Randy George and Eliza Kane, Red Hen Baking Company has been on the leading edge of the local food movement since 1999. Back to our discussion with Dan Daltry of the Vermont Department of Health.
How do you think people are viewing COVID today?
Of course, it depends upon the individual. I think there's individuals that still think of it as nothing more than flu. And I'm not here to judge. I'm not here to change somebody's worldview. There are people that lost loved ones. There are people that live with chronic infections or disease that won't let this go. I think we have a grand diversity upon what people see or think about COVID. I think there's people that have been traumatized that can't go back to that period of a mask in hopelessness, because I do think individuals felt hopelessness. In my heart of hearts, I experienced hopelessness. I wouldn't allow myself to say the words, but absolutely that was there. That mask could be triggering, could bring that back. And who knows, maybe I wear mine just because I remain with some trauma about what it is I saw and experienced with individuals, I don't know. Some of the greater minds here at the Department of Health were looking at some of the data and who were contacts and how people were contracting that. And somebody had the idea, now wait a second. This person got infected, but we have nobody that had been around them 6 feet or less, given their job, 6 feet or less for 15 minutes or longer. Impossible for someone to have met that criteria. What could this be? Kept thinking about it, pondering it. They were a part of the thought that originated and ultimately was endorsed by the CDC, that cumulative exposure. 2 minutes here, 2 minutes there, 8 minutes there. Once you get to 15 minutes cumulative exposure to somebody that had it, you could have it, right? So that's kind of the way that it worked. We started with a script wide open. We were asking even medical providers that were doing consults on individuals with COVID to fill out this laundry list of questions to feed data here internally for our own purposes, but also on an aggregate level by the CDC, so they could put it in their vast vault of non-identifying information, but looking at risk scenarios, I remember the provider that had done 35 consults, and I'm asking them to fill out an 18-page form. Would you like me to do that? Or would you like me to continue to help other medical providers? Fair. you know? Life is happening, but we also needed to research and adapt at the same time.
Do you remember the basketball game up at UVM?
Yes, we interviewed somebody that was at the event and began to look at and think about who could have been exposed. And by this time, our response had matured. We had various teams, prongs to the response. So there was I was on a team called Case Investigation. We were the folks just interviewing individuals that were impacted. Then there was another team called Outbreak Response. And so when we began to see a cluster, that got assigned to the Outbreak Response team that was able to get out messages or work with leaders to provide information. So I can't speak to what other teams did. I know that within our team, we identified an event and elevated it for response.
Tell me about your learning journey on this.
When I talked to you earlier about not wanting to stand down, not wanting to take time off, we at some points were conducting interviews and 4 hours later having to call people back and interview differently because of new information that had just broken. That wasn't pleasant. That wasn't pleasant at all. I want to give somebody that I'm serving the best of what I know and the best of what is out there. So 4 hours later, this new detail is released. Am I to sit on that for another day and for a new customer? But how can I do that when I had just worked with somebody 4 hours prior? There was an individual that we called There Was a Day, and I forget the exact thing. It was our approach, but we changed 4 times in the course of a day one aspect of a prevention measure based upon information that kept coming in. We're going to do this because the CDC says, CDC has changed that. We're going to do this because the CDC says. CDC changed it. We're going to do this. In the beginning, we wanted to have the best and most current information. And we acted upon it quickly here in Vermont. Maybe at times too quickly, but it was always with the intention to serve someone to the fullest of our abilities. People, hopefully were trusting me. And I feel like in some ways, I failed that trust by not giving the best information. Or in my willingness to serve, I jumped too soon. I had to learn that lesson time and time again in COVID. Slow down. You want to serve, but sometimes just responding to that thing in that moment isn't really doing what your objective is. I remember maybe a month into this, just talking about how grateful I was to the people that I served. People were incredibly open with me about where they were, what they did, who they saw, letting me know names and numbers of people, of contacts that I could call, There was one of my colleagues that was doing an investigation, and the person they interviewed, they had 25 contacts that they then had to call and notify. Throughout the response, the majority of the response, I would say greater than 80% of the individuals that I interviewed wanted to share about who could be at risk and how to reduce their own risk. It was an incredible testimony of the humanity that I served. I really did find a warm welcoming and strength in the folks that I worked with, and openness. There were people that were frustrated. There were people that were angry. There were people that called me something other than my name given to me by my parents. That happened, but that was such a small proportion of the folks that I had the privilege of serving. It was constantly adapting, trying to be empathic, while also trying to share the science that was known and what I believe to be the best science. If I had a magical wand and I could redo it again, there would be an opportunity for us to pace ourselves, to not work those 6-hour to 10:30 at night days, to try to ensure that we had a depth of coverage where people could take off a week after being in service for 6, just to give people a chance to recharge and not try to go all in, all after this. For me, that was the hardest thing, is that I didn't let up. And there are individuals around here that were far more successful at continuing on, soldiering on. Pacing. I wish we all had better pacing about it. And that, in the end, by having pacing, it didn't mean that we didn't care any less or that we weren't doing our job. That was the hard thing. I think a lot of us felt like we weren't giving our best unless we were going all in. One of my colleagues had a mantra that she would share among us investigators. And she would say, and it was given to her by somebody else, but she shared, an empty cup can't pour water. An empty cup can't pour water. There was a lot of empty cups, but we didn't acknowledge that there was no water. But I definitely knew, as we were approaching that year mark, that I was cooked. That I didn't have much more to give. I felt very raw and vulnerable. I wasn't receiving critique well. I had a very thin skin. And I can't pinpoint an exact event, but I do know, as we were approaching the year mark, and maybe this, you said the word hopeless before. It might have been around that year mark that, though I wouldn't allow myself to say the word, that hopelessness was really creeping in, because here we were a year and nothing had changed. And I didn't know when it was going to end. I do wonder, are you a therapist or are you an interviewer? I do wonder if a part of that year around the hallmark, part of where I dove in, was me going into my second year of grieving my father and being of service to others. My father retired as a lieutenant colonel from the Army, and we moved around a lot as a family. I learned about his world, different world than mine, but he taught me about commitment and seeing things through and service to others and when called upon. I think my father was with me during the service I was doing to others. You
think you made a difference?
I hope I did. I did. It's hard for me to say that I did, because I don't think that that's humble at all. I do know that there are situations that I was a part of that, in partnering with somebody, I stopped a spread. So in that very instance, or I helped somebody, I was a part of helping somebody to find out their status. That makes a difference. I'm not saying I'm the one that got the person to get a test, but I was a part of a conversation helping somebody to know and promote and tell where they could go to get that test. I know that there were little mistakes that I made along the way, not having enough patience, not pacing myself enough. But I also know there are things that we did right, jumping in as fast as we can to be present, to partner with individuals that were being impacted. That was never wrong. It's still something that we're on a journey here at the Department of Health, helping folks to still unpack. It's still with us all. Us that were here, it is still with us. We are learning to be, I think, more patient with each other. We are learning more greatly about the importance of an investment in humanity, in the sense of equity, and in looking at health outcomes, how we need to do more, to challenge ourselves to do more, to not just have a dare I say, it's not just science, that our field is also very much about humanity. I think we've learned to grow deeper and more fully, and have learned the importance of partnership. I think we've always had that with communities that we serve. That trust is a gift, and we need to continue to honor that. And you can't have a partnership if there's not trust. I'm grateful and honored that I got to be a part of this, and I wouldn't change it for the ups and downs, for everything that it was during these days of COVID. It's where I needed to be, because I don't know how I would have gotten through that journey if this wasn't something that I got to be a part of doing. You know, St. Ignatius has a thing about to love and serve in all things. This was my chance to be of the world, to be a part of the world, and to share my talents with all things, to serve, to love and to serve in all things, to serve Vermonters, to take what I've had the privilege of learning and to use that knowledge base of public health for this pandemic that soon there came. And I was able to use that in service to others.
That wraps it up for this edition of 802 News, sponsored in part by Red Hen Baking Company. Thanks for listening.